Welcome, everybody, to this episode of the Building with Purpose Conference. I am joined today by Dr. Hugh Beatty, the wellness doc. He is much more than a doctor. He's a friend. We've known each other for a couple of years now. And when I made the decision to expand this conference and say, we don't just want to talk about the business aspects of ownership and entrepreneurship and how do I run and market a business, this year I really intentionally said, I want to talk about the total health of the business owner. And that means the ways we take care of our bodies as business owners. And he was the first person I thought of. He was part of the reason, quite honestly, I wanted to expand the program, because the stuff that Dr. Beatty talks about is stuff that not just everybody needs to hear, but business owners in particular. We are a special breed. We put some unique stresses on our bodies. And the thing that he does is helps people take care of their bodies. He practices wellness medicine, and he will explain what that is and some of the different stances that he takes on things. But Dr. Beatty, welcome to the Building with Purpose Conference. I'm really excited to have you today.
Thanks, Justin, for having me. I look forward to talking to you today.
And one of those things, so we'll get maybe to some of the business owner things, because I want to pick your brain about being a business owner. You've been one for a number of years. But let's start with what exactly it is you do. That as a business owner, I'm listening to this conference. Maybe I'm realizing the stress that 2020 has placed on my body. And I know you're big about dealing with stress. So walk us through, we'll just say you've got these 5 pillars of health that people need to look at. Walk us through briefly what that looks like.
Yes, Justin, thanks for the question. Yeah, I practice wellness care, and really the technical term is called functional medicine. Functional medicine, in simple terms, is just get the body to function normally. Disease, another name for disease is dysfunction. So people come to me with all kind of dysfunctional problems, whether it's joint problems from arthritis, whether it's diabetes, hypertension, heart disease. And I just try to return the body back to normal functioning. And in order to do that, I set up a program I call the 5 pillars of health. And in that 5 pillars, I focus on hormone balance, which is the most critical thing, gut health, nutrition, a good night's sleep, resistance training. But now I even have a foundation to my pillars. A foundation is water. And I just recently added a roof to the building. I call it love. Because without love, you're going to have a lot of oxidative stress. And really the 5 pillars is about controlling oxidative stress.
Excellent. So what are some of those, maybe somebody's listening to this and saying, well, how do I know if some of these things you're talking about, oxidative stress, is affecting me? Are there ways that I could look at changes in my own body and say, oh, maybe I have something that you can help with?
Yeah, it's very manifest to me. I can be with someone and just look at them and tell that they already have oxidative stress, because it's exemplified by inflammation. And a sign of inflammation is just obesity. And if you think about the number of people that you encounter that are obese, then that already lets you know they're inflamed, because just having excess fat on your body is an inflammatory state. And that inflammatory state is linked to oxidation.
Excellent. So let's run through these 5 pillars and the foundation and the roof really quickly. And I know, I mean, having known you for a couple of years and seeing some of this continue to take shape, you've made this foundation water. What is it about our modern society? I'm convinced, in my limited understanding of fitness and health, we are pretty much constantly walking around dehydrated.
Yes.
And what are some of the side effects of this perpetual dehydration, and why is a foundation of water important to you?
Well, the body as an adult is 70% water. And when you don't drink enough water, one of the first signs is just gut problems, constipation. It's amazing to me that some people get so constipated that they start leaking stool around the constipation, and they start having diarrhea. And then I have to tell them, you're constipated. I get an x-ray and I show that they're full of stool. But other signs that manifest is that they have chronic dryness of mouth. They can't lose weight because it takes water in order to start the first step of lipolysis, which is hydrolysis. You need water to do that. In addition to that, they have dry skin. Their skin is flaky. They have all kinds of different types of dermatitis as a result. But they feel chronic fatigue. And so just water itself, you'll be amazed when you get people to hydrate more, they begin to feel better. And they have less oxidative stress just from hydration. Let me make this quick point. You need to drink at least half your body weight in ounces of water a day. So let's say a person weighs 200 pounds, which is not unusual in the United States. They need to drink 100 ounces of water a day. and it's 30 cc's an ounce. So 30 times 100 makes it at 3,000 cc's, or another name for it is 3 liters. So the typical 20-pound person needs to drink at least 3 liters of water a day. And if they're active and they're doing sports activities that cause them to sweat, they need to drink a little bit more water. The only side effect of drinking too much water is that you can get brain swelling. So I tell people they need to follow the hard, fast rule based on their body weight and their physical activity.
So water is really that thing where we all need to start, that maybe I can see some minor health improvements just by simply drinking more water and being properly hydrated. But I know the big one for you, both men and women, but especially I hear you talk a lot about women, is the importance of hormone balance. And so again, what are some of those things to look for there?
Well, the hormone I tell people that is life-threatening is cortisol. And cortisol is a stress hormone. And if you're under stress, I don't care what age that woman who is past like menarche or her first menstrual cycle, from that age, let's say 13, if her onset is menarche, up until the time she dies, your hormones are critical for women. They're critical for men, but even more so for women. And the thing is, so a young woman, if she's under stress, it can throw off her ratio between estrogen and progesterone. If her estrogen levels are higher than her progesterone levels, then she's going to have a myriad of problems. And it manifests as irregular periods, painful periods, mood swings, trouble sleeping, gaining weight. She can go on and have tender breasts. She can go on and develop uterine fibroids. She can have problems with ovarian cysts, endometriosis, fibrosis of the breast. And so I see a myriad of these things. A lot of times it's not so much that they were born with a hormone imbalance, it's that stress-led. But the other causes of estrogen dominance, which I see very common in women, is not only stress, but also constipation. If you're chronically constipated, the liver cannot deal with metabolizing estrogen. That's where estrogen metabolized. It's dealing with all the toxins coming from the gut. And so then now they become relative estrogen dominant based on the fact they're constipated. And the third cause of estrogen dominance in women, which I see is very common, is that women who are estrogen dominant, they get estrogen from the environment. There's phytoestrogens and things like that. Or they get birth control pills from their doctor. Or they're trying to do something that their doctor's trying to manage with their hot flashes and postmenopause, so it only gives them estrogen. And when a woman's estrogen dominant, now they cannot burn fat, lipolysis. There was a study done where they put fat in a petri dish and they put a drug with it that actually breaks down fat. But when you add estrogen to that medium, it stops the process. And then once you have estrogen dominance, you get this vicious cycle. The more estrogen, the fatter, the more estrogen. And women get very discouraged. You can't even get them to the other 4 pillars because they don't feel well, and they don't have energy, and they're stressed out to even do the other 4 pillars. So that's why hormone balance is critical in women.
And certainly so, and yet maybe even to a different degree, men have traces of estrogen in them. And you talk about hormone balance for men as well. So what are some of those warning signs for men facing hormone imbalance?
Well, for men, I just look at their belly. I just go right to the belly. The bigger the belly, the lower the testosterone. And a euphemism way of saying it, the bigger the belly, the lower the T. And the thing is, when men have low T, generally it's because of not only stress, just like in the women, but also it's because testosterone gets converted to estrogen in belly fat. So when these men have this belly fat, they're cycling this estrogen. So it's not unusual that men will come to me with symptoms of low T, low libido, problems with erectile dysfunction, no zest for life, poor focus. And they want me to put them on testosterone replacement therapy. And I said, it's more involved in that. I said, if I put you on testosterone and you have all this inflammation, this belly fat, you're going to convert a lot to estrogen. If you convert to estrogen, you're going to start having tender breasts. You're going to get what we call man boobs or gynecomastia. You're going to increase your prostate size. You're going to increase your risk of breast cancer and prostate cancer. So at the minimum, I have to educate them and tell them I got to block that enzyme that converts testosterone to estrogen. And that enzyme is called aromatase. And that aromatase is stored in belly fat. So the fatter you are, the higher the aromatase. And you block it with a drug called anastrozole.
You have one of my favorite sayings that makes me laugh every time you say it. I was hoping you'd use it here, but I get to now. Nothing grows in the shade.
Yeah, I was going to say that. But
that's how you diagnose men. Nothing grows in the shade.
You got a big belly. Nothing grows in the shade. And so I thought you was thinking about when I have a plaque in my lobby says, from your mouth to your butt, how healthy is your gut? I thought you was thinking about that one too.
Well, that one's very important, and that, I mean, leads us to this second pill, right? So if the first one is hormones, the first thing I need to do is drink some water. Then I can come and see you and get my hormones balanced and start to fix all of that stuff. But the next part of this is gut health, right? And it's been said that the gut is the second brain. So walk us through a bit about this idea of the importance of gut health.
Yeah, the gut is so critical because that's where 70 to 80% of your immune system resides. There's only one cell layer in the gut that protects you from your internal organs. So when you look at the immune system, it's right there at the gut level, and then you start getting gut inflammation. You can eventually get leaky gut. When you get leaky gut, now you have all this toxin coming through. The immune system is trying to deal with it. It then gets overwhelmed, and then it starts attacking itself. It doesn't know what's friend or foe. And so it's not unusual when I see women and they have thyroid antibodies. Thyroid antibodies is a sign of gut poor gut health. And so then they can go on to develop other autoimmunities. In fact, autoimmunity is more of a problem in women than men because it's linked to progesterone. And if estrogen protects a woman's immune system. And so what happens when you have that hormone balance, they're a lot more likely to have autoimmune problems. And one of the first things you see is Hashimoto's. But autoimmunity is also Graves' disease. And so one of the things I tell them, I said, look, we get you on iodine to counteract the effect of the autoimmunity of thyroid disease, but also we need to clean up your gut. And one of the first things you got to do is get them hydrated so they can at least have regular bowel movements. The other thing that you see common in poor gut is that they complain of bloating and gas. And so the doctor then puts them on a proton pump inhibitor for that. And that starts an ugly cycle. Now they don't have enough acidity in their stomach. Without acidity, now they can't keep the bacteria in check. Bacteria is supposed to be in your colon, not in your small intestine. It's supposed to be sterile. And when you start getting this colon bacteria, this harmful bacteria backing up what we call dysbiosis, now you get it in the small intestine. And that's called small intestinal bacterial growth. When you get that, you are really prone to leaky gut. And that's what the problem is.
And I want to stop before we move on to the next pillar, especially some of this technical stuff. I suppose it's easy for somebody who's watching this to say, well, but Dr. Beatty, that's not me. I'm mid-30s, I'm late 20s, maybe I'm early 40s, whatever. I'm still relatively healthy. I don't have any of these diseases you're talking about. I must not have a problem. And yet I'm also guessing you would say it's not quite that simple. And so what are maybe some of those preventative things or maybe some of those danger signs that I don't have what you're talking about, but I still need to be aware of?
Well, the problem is I tell people all the time that youth is good and bad, okay? And like you've heard the expression, youth is wasted on the young. So a lot of their benefits of youth is coming really from their mother. They get all the benefits of the mom's nourishment in utero. And then if they're in their 20s and they're not doing anything to maintain that, and they're not taking vitamins, their vitamin D levels are low, their iodine levels are low. They're just setting that they're ticking time bomb for what's going to start happening in their 30s. And so by the time, it's unusual now to see people fit even in their 20s now. But by the time you get to the 30s, men already have this abdominal obesity. They already have that. They already got inflammation going on. So when I see them, it's not unusual for me to put a 30-year-old man, a 30-year-old woman on a TWD scale. And I'm showing them already that they're older than their chronological years. Their metabolic physiologic state sometimes is 10 or 15 years older than their chronological age. And they're feeling well, but they're just blown away. And I said, well, we can begin to intervene now and get your body healthy. Let me make this point real quick. It's not unusual, at least about 10% of the time, Justin, I will see a patient. I say, medically, you're fine, but you're not well. And they're blown away by that. Because I tell them, I said, look, there's nothing I need to give you a medication for. I don't need to manage an illness. You don't have a defined illness yet. But you're on your way to diabetes because you got insulin resistance going on. Your vitamin D level is low. Your thyroid TSH level, the thyroid hormone, is a little bit on the high side of normal. You say there's nothing to really justify intervening, but that's the best time to intervene. And I start saying, look, let's start doing the 5 pillars. A lot of young people in their 30s, especially men, they have adequate testosterone. So it's not a testosterone thing. They need to hydrate more. We need to clean up that gut. We need to get them a better nutrition. Give them supplements they need, the vitamin D, the magnesium. And then we need to make sure they're getting proper sleep. When you're young, you think you're invincible. So you don't have a pattern of proper sleep. So instead of drinking water, you're drinking coffees and teas and sodas and everything else, alcohol. And they don't understand the importance of the water. So by the time they look at 40, now they have these diseases that set in. You see, so I just tell them it's a process. You just haven't gotten old enough yet.
Yeah, and I think that would be eye-opening, right? If I may step on that device you have, and my chronological age is 35, and all of a sudden it tells me I'm 43, 44. Maybe that's an eye-opener.
Yeah, Justin, I look at you, it would say 20.
I appreciate that.
You're very fit. And I'm pretty good at guessing it because it really has a lot to do with how you physically look. Okay, if you got abdominal fat, then the problem is it just ages you. It just maximizes your.
And one of those things you said in there, I think, is the important distinction of what you're bringing to the marketplace, and that is, you said medically you may be fine, but you're not well, and that's the difference between medical care and wellness care. So why don't you started out as a medical doctor. Yeah. So give us briefly, we'll jump back into these pillars next, but walk us briefly through what medical care is and what wellness care is and your journey into that.
Yes, I'm still a medical doctor. I'm still licensed by the medical board. Okay. But what I've chose to do is do wellness care because, to be honest with you, and I'll define in a second, but to be honest with you, wellness care is really the highest level of care you can give a patient. And medical care is really, we call it evidence-based medicine, but really the end result is we're just managing illness. We're keeping people sick. We're managing them with medication. So, in our country, we are great at acute care. If you got something acutely going on, the United States is the place to be. But with chronic disease, we fall off. We're terrible at managing chronic disease. So that's the difference between medical care and wellness care. So by definition, I call medical care medical management, managing your illness, keeping you sick, or giving meds to treat your symptoms. That's all definitions I use for medical care. While wellness care is that a person who's well no longer need a physician. They do not need me. I get patients from the point where they needed medical intervention to wellness all the time. It is the simplest visit I have with patients. They come in at least twice a year just to assess where they are, look at their hormones, might look at certain labs. And the patients are doing well. They love it. In fact, they began to tell me, "Doctor, this is the cheapest care I ever received in my life," because they don't need a doctor anymore. As scripture says, who needs a physician? The sick need a physician. Wellness patients are not sick. They're well. That's what it means by definition.
Yeah, excellent. Thank you for that clarification. And so let's dive back into these 5 pillars. So we start with this foundation of water. We have our hormone balance, we have gut health, and number 3 for you is nutrition. So walk us. I don't like vegetables. Doesn't matter, right? Like, walk us through what good nutrition actually looks like.
Well, since you don't like vegetables, I would say get a blender and blend them in there and throw a banana in there. Okay, but no, we need whole foods. We really do. As they say, I think Whole Foods moniker was your food is your medicine. And you really need to look at it that way. But even with whole foods, we still have nutrient deficiencies with it. So it still requires that we supplement even when we're eating whole vegetables. I personally like to eat a salad a day. And I call it a salad because I want to get as many different whole vegetables, fresh vegetables in there. We can overcook our vegetables too. We can oversteam them. We can over saute them and all this other stuff. We're cooking the nutrients out. So I try not to heat up too much fresh vegetables. I try to get a healthy serving of fresh vegetables in a rainbow assortment every day because there's so many antioxidants in there. One of the things that I monitor in patients and blood tests is C-reactive protein as well as HDL. And HDL is what we call the good cholesterol. The only way you can get that good cholesterol up is to eat fresh whole vegetables. And one of the things that you can lower your C-reactive protein, which is a sign of inflammation, is to eat fresh whole vegetables. Fresh whole vegetables are powerful antioxidants. The food is in a reduced state. So that's why it's important.
So magic may not be the right word, but it sounds like there's a bit of magic in eating these nutrient-dense foods, right? It gives us a lot of those fundamental amino acids and building blocks of things, vitamins and minerals that our body just needs to be able to produce longevity, right?
Yes. And I'm glad you used the term longevity because Here's the thing. I'd like to clarify longevity a little bit better. I do have a curve, and I will give that to you so you can post. But there's something I tell patients when they come in. I said, what if you had a twin, and you both were born on the same day, and you happen to die on the same day? Okay, and that's your lifespan. But let's say one twin was very into fitness, exercise, ate right, part of the wellness program, but the other twin just chose medical management. Okay, so they have the same length of life, lifespan, or longevity, but one has a different health span. Okay, the one who is healthy had a long period of time of healthy. Let's say they both died at 100, but the one who chose to be healthy, let's say they died one day. They was in bed, they just fell asleep and died, never woke up, and the other one died in nursing home. Let's say from some kind of medical intervention. Now, the one who died in her sleep, she was just driving a car the day before. She was out taking a walk. She was working in her garden. She was enjoying books and people. She was hanging out with people who were 50 years younger because she had energy, while the other one maybe spent the last 20 years in a nursing home. So I tell people all the time, you want a health span. I don't increase your longevity. God numbers your days. But what I'm trying to do is help you to enjoy that life that God has as long as you can. So health span is what I focus on.
Yeah, excellent. Longevity is certainly something, but quality of life is another part. And I want to get your take because it's very popular, right? Somebody makes it to 100, 105, and they interview them on the news, and they'll say, Frank, you're 105 today. What's your secret to long life? And it's never actually anything to long life, right? He'll say, like, I smoked a cigar and drank a Dr. Pepper every day. Well, you got lucky.
Yeah.
So what is that real secret to not just longevity, but quality of life along the way?
Well, I think it really involves the 5 pillars and the foundation being water. But now I have that roof, love. If you are surrounded by love, you have a zest for life. Just think about it. So just like we have to manage our health, we have to manage the environment we put ourselves in. If you're in a toxic environment, that is very oxidizing and stressful. So one of the keys of life is making sure that you stay in loving relationships. And if you love your body, you're going to take care of it. If you love those around you, you're going to help take care of them. But also you can protect who you bring into your environment. And I don't think we do that enough. I have patients who are in toxic situations all the time, and they do not want to do anything to remove themselves from that. I tell people for years now, when you're under stress, you got to remove yourself from the source of stress. I'm not into trying to get them to cope with the stress. I think that's the worst thing we can do. I was an anesthesiologist for years. And one of the things I began to realize that I didn't want to deal with the stress forever. The late nights, the weekends, the unpredictable schedule. It was not unusual to work 89 hours a week. And I look back on that, I sleep every night in my bed. And there was a lot of times I would not sleep at home. I would be on call, OB and things. And I said, if I knew wellness now, like I know now, then I probably would have quit even sooner. So the thing is, I did something about it. I removed myself from that stressful environment. And so I encourage people all the time, they need to do the same.
Excellent. Thank you. We will continue to hear from Dr. Beatty after this brief break. All right, welcome back. So we are continuing our conversation with Dr. Beatty, and we ended prior to the break talking about this stressful environment. And I completely agree, not just that maybe we need to remove ourselves from that stressful situation, but we need to do a better job of managing stress. And so what are some of those tips and those tactics you give your patients on stress management, especially, like, let's just be honest, 2020 was stressful for everybody in a variety of different ways. What are some good stress management techniques that we can use to control our environment more?
Well, one of the things is, as I mentioned before the break, is that you got to surround yourself as best you can in a loving environment. But when people are under stress, there's certain supplements I give them. And always keep in mind, Justin, I know you know this, that supplements have side benefits, while medication has side effects. So when somebody's under stress, I'm not grabbing for the benzodiazepines like Xanax and Valium, things like that. I'm not trying to give them, Ambien to help them sleep. I'm going to my tube case and saying, what supplements and herbal supplements that I can give that's going to have other benefits. And one of the things I will tell patients to do is that, one, look at L-theanine. L-theanine, head-to-head to Xanax, has a lot of benefits so far as relaxation, but it's also neuroprotective. The other thing is ashwagandha and rhodiola. But B complex. B complex is critical because when you're under stress, that's an oxidizing process. So you use up a lot of energy. When you use up a lot of energy, you're wasting ATP. because of your stress, even though you might not be active. And so I really increase B complex in patients, make sure that B complex is up. And if I can get them, and I will also offer them CBD oil, and in addition to that, melatonin. And so if I can get them to get a good night's sleep and manage their stress during the day as best they can with some of these herbal supplements, and all these things they can get over the counter on their own, you'll be amazed how much better they do. If they're going into the source of stress and they already are hormonally imbalanced, I make every effort to make sure they don't become imbalanced. So I encourage them, hit the gym, do resistance training. Here's something that I tell people all the time, because so many of my patients love to do aerobics, and because they find enjoyment in it. People don't like lifting heavy things. And I say, look, your body physiologically doesn't know if you're doing aerobics because you're running from danger or not. And so when you are out there really pushing your body in aerobic activity, your cortisol levels go up. And when you're stressed, you do not need high levels of cortisol. When you're lifting things, it's like working. The body thinks that it's working. Because who stops to dig a ditch when they're in danger? Nobody does. So when you're lifting something heavy, all of a sudden the cortisol levels come down. You release also something, a very, very powerful antioxidant in the muscle. And that antioxidant in the muscle also lowers oxidation. So if I can get people to get a good night's sleep, if I can get them to take the supplements to help with their stress and get them to lift heavy things, it goes a long way to cope with the stress.
I do not get people that enjoy aerobics. So I know we're back to that fourth pillar now. We're talking about some of that importance of resistance training, and you certainly did a good job of introducing this topic. But what are some of those other? I mean, so it lowers stress. What are some of the other physiological benefits we get through a good resistance training program?
Well, resistance training also raises testosterone in men and women. It strengthens your muscles. And the muscles can help protect the joints. It helps you burn fat when you're even at rest. Even from a quality perspective, I look better now than I did 10 years ago because I lift weights. So it does body contouring. It makes you look younger. It makes you feel better. And then if you're ever in danger, you feel like you can handle yourself. You can either run or you can fight. But if you're frail and you're falling apart, I mean, you're just like a sitting duck. One of the things is when you get past 60, you can lose as much as 2% of your muscle mass every year. And it's known that people who are more physically fit, i.e. muscle tone, they do much better when an illness or sickness comes, or if they have to have surgery, than someone who has a high fat percent.
And certainly as we age and we tend to lose that muscle mass, and particularly as our bone structure gets weaker, it opens us up to a whole new breed of illness and injury, right? And the percentage of people that, die from falling and breaking a hip. And one of the simplest ways you can do that is continuing to build up the muscle mass. I know when I worked in the gym and worked with older clients, we'd focus a lot on leg strength and short bursts of that quick movement, right? If my foot does trip, I need to be able to catch myself and not fall. And so it doesn't always have to be lifting to look like a bodybuilder. It can be lifting, again, back to your earlier point, for longevity and quality of life sake.
Yes. And they did studies where they looked at patients or people in nursing home facilities. If they can get them to do even light resistance training, they started to see that their muscles began to improve. It's called sarcopenia, that you started seeing that the muscles got healthier, even though patients were in their 80s. So you're never too old to lift. The other thing I should have mentioned too is that it can keep your bones strong. One of the things that I noticed as my dad, as he got older, he was 6'1" when he was younger. He probably shrunk down to 5'9". Lifting weights keep your bones strong, keep your spine height there too. And one of the things, I'm 6'3", and I'm still 6'3", and I'm 62. I want to keep being 6'3". And I don't want to shrink. And that's one of the things that can happen if you're not keeping yourself fit, if you're not doing what you need to do for your overall health.
You've talked about this before. Let's move on to this fifth pillar. You briefly touched on it, but it's this importance of sleep.
Oh, yes.
Man, I was in college, and I was never particularly enjoyed those all-nighters, but I had friends that seemed really good at them. Yes. Maybe it's laziness, but I like sleeping. Yes. What are those benefits of sleep?
Well, sleep is very critical. In fact, going through medical school and residency training, there's a lot of sleepless nights. And I remember I used to just pray that I could get some sleep. I remember I used to hunger for sleep more than food. It got so bad. I remember one time in internship, I had been up for 36 hours, almost 40 hours, and I was driving home and I fell asleep at the stoplight. And I'm surprised. I'm glad my car didn't roll because I remember I stopped and I put it in park, and I woke up a few minutes later like, what in the world am I doing? And I shouldn't have been driving, but I was 26 years old thinking I'm invincible, and I had to drive like 3 miles home, and I was just dead tired. So yeah, sleep. I love sleep. I really should spend more time sleeping. I tend to go to bed at midnight and get up at 6:37. I should go to bed earlier, but I'm so busy in the evening when I get home from work that that's the best I can do. But sleep is critical from this perspective. You cannot survive without sleep. There was a doctor I saw on, it was an article that was posted on the internet where this neurosurgeon in Korea, I don't know if he was the only neurosurgeon there, he had been up 48 hours and he died operating the OR from lack of sleep. Mm-hmm. Okay, so lack of sleep will kill you in a short period of time. You can, oxygen, deprived of oxygen, your brain dies in 5 or 10 minutes. You can go maybe without sleep for 48 hours or so. You can go a little longer without water, a little longer without food. But man, sleep is critical. That's the second most important thing, short of air.
I used to tell people that going through life, right, just pick your normal average day. You do damage to your body through, we're here in Bakersfield and there's air quality issues, or the food that you choose to eat, right? If it's got a barcode, that's not the greatest source of food for you, right? But just normally going throughout the day damages your body. And the one chance your body has to repair that damage is when you're sleeping.
Yes.
And so I would always start like, whatever your fitness routine program is, right? This is when I worked in the gym. Whatever your fitness routine program is, it needs to include sleep.
And lack of sleep is it causes what we call oxidative stress. It increases the reactive oxygen species. And I tell patients who come to me sometime who do shift work, they on the graveyard shift, and they come in, doc, I'm so fatigued, they're stressed out. And we teach in wellness that unless a person sleeps during regular hours like everyone else, I tell people all the time, you want to sleep with a bird of sleep. So once the sun goes down, really that's the message that you should be also thinking about going to sleep. But there's critical hormones that are released between 1 and 4, growth hormone and testosterone. And if you're up all night, you throw off the whole circadian rhythm. And so that's one thing. It's hard to really get people healthy who are doing shift work. But getting back to sleep, so if someone's not getting adequate sleep, eventually they're going to have some depressed cortisol levels. And with those depressed cortisol levels, there's not much you can do until you get them back for a normal cortisol pattern. Your cortisol between 7 and 9 is supposed to get as highest of the day. Give it that cortisol increase so that you can have the energy to start your day. And then the cortisol is supposed to be at the lowest at when you're time for bed. And so I tell people there's an inverse relationship between cortisol and melatonin. Melatonin should be at the lowest when you wake up. As soon as the sun or ambient light hits your eyes, melatonin levels begin to drop. Cortisol is supposed to spike when that happens. And then you have the opposite when it's bedtime. Melatonin is supposed to spike, cortisol is supposed to come down. So you're bringing up the whole cycle when you're doing shift work. But so sometimes patients' hormone imbalance is so bad, I have to give them melatonin that night. If you don't need melatonin, your body will let you know. You'll wake up drowsy. But if you need melatonin, you'll get a good night's sleep. That's one of the simple ways you can know.
Interesting. So we've covered this foundation. We've covered these 5 pillars. We've covered this roof. And over the number of years that you have been practicing and perfecting this and helping patients, you've undoubtedly learned a lot as a business owner. And we have just a few minutes left in our time with you. And I want to shift there because you started out in medical care. You've made this shift to wellness care. People attending this conference are business owners, or at least key business decision makers. What are some of those maybe life lessons you've learned as a business owner, as your own story has unfolded? What's some of the wisdom that you've gained along the years?
Well, it was a longer journey than that, Justin, because I went from being an anesthesiologist, and anesthesiologists do not have private practices. So I still get that shock look from when I encounter surgeons or anesthesiologists, you're in private practice? And then to go from anesthesiology to primary care and now wellness care, that's shocking to them. And along that way, because I was really just going down a path, like they say, the path that's least followed was the path I was taking. I had to go ahead and do a lot of novel approaches. But I always enjoyed business. When I was an anesthesiologist, I was starting to get all this money, didn't know what to do with it. So I was reading books on business and entrepreneurship and things like that. So that's why I wasn't afraid after 7 years of being a full-time anesthesiologist in my mid-30s to say, hey, let me do something different. And so I did investment instruction. I started a business in investing. I went across the country doing workshops in investing. And then I said, well, if I go back to medicine, I want to do it different. I want to be employed for myself. So I never was afraid of being employed. And then also, I'm a man of faith and to always walk by faith, but I knew I needed wisdom with that faith. So I had to learn. So initially, I leased space from another physician in town. And I learned a lot how he managed his practice and how he did business. And I just grew my practice along that way. And so I've always learned that without profit, if you don't make a profit, you're not going to be in business very long. And so sometimes I mention this to patients. I say, look, if I don't do the business side well, you will not have your wellness doctor, because wellness doctors are not employees. If you look at people who are doing functional medicine throughout the country, they're solo practitioners. They're one man or one woman operations. They don't tend to have nurse practitioners or PAs working for them. They tend to have offices that sees a certain amount of patients a day. The number is usually about 10 patients a day, because they're really going to offer them benefit and treatment. And insurance companies does not pay for that level of care, so they have to pay out of pocket. But in the long run, it's the cheapest care they ever will get. And so I've always had to keep my eye on the business side of things. Even now, I don't work Fridays, so I can do business development. So I can pay attention to the bottom line. And it does well for me. And with my practice, as far as my staff, I pay attention to their needs too. I try to create an environment that they have less stress in. I have 3 employees, so every Friday they rotate. I only have 1 employee here till 2. The other 2 are doing whatever they want to do. They can take care of their personal needs. They go to doctor's offices, whatever they want to do. And they stay satisfied. I keep their levels of stress down. So when they show up on Monday, they're eager and ready to go. It's not unusual, Justin, that when my employees, like for any length of time, like a break, we take vacation, or some kind of holidays come up, they will tell me, Doc, I was bored at home. I couldn't wait to get back to work. I smile, because how many employees really feel that way? And so I like to think I've created a very welcoming environment for my employees, which keeps their stress down and my stress down.
Absolutely. And there are a number of studies about how employee engagement drives not just profit, but ultimately customer satisfaction. And how have you seen that correlation of your happy, engaged employees providing the level of care that you expect them to provide, and that being met through patient care?
Yeah. Well, it all starts with the patient. Without the patient or the client, we don't have any business at all. There was a concept I learned a long time ago by this guy named, what was his name? Cook. I can't remember his first name, but he was an investor. And when I was going to all my investment seminars back in the early 90s, he said that everything's involved in the meter drop. So he was a cab driver at the time, and he learned that, hey, dropping that meter, he would get $1 just for somebody getting in the cab. And so he never focused on where they wanted to go. He said, I just got to keep dropping the meter. That's how when I started doing private practice, I looked the same way. I said, the patient's going to come for a myriad of things. I don't focus on why they're coming. I just say, get them here. Once they're here, I can begin to help them. So I always look at it as a meter drop. No matter who's coming in, if they're coming in just to establish, or are they coming in because they want wellness, or are they coming in because of pain? Once they get in here, I can then begin to do what I need to do. And so it's always been in my background, business. And I know that I enjoy business. That's why I can do it. So many doctors have gotten frustrated over the years and being in private practice. That's why they gave up and sold their practice. That's why they joined these corporations, but they're not satisfied. And I think that goes a long way. Not only doctors aren't satisfied, but it also impacts the kind of care they give the patient. I have a vested interest in my patients doing well, because they're really, each and every individual patient is my boss. They come in, I'm there to meet the needs of them. There was a book I read years ago about how to win friends and influence people. Okay, Dale Carnegie. And
Yeah.
he said something, I don't remember much of the book, but he said something where he said, look, if you help people meet their needs, then the world is your oyster. So that's what I'm all about. Drop the meter. Find out what the patient needs. Find out what their problems are. Give them a diagnosis. Get them healthy. And then guess what? You don't have to worry about the business side. It's going to flourish. And I see that all the time, more and more in my practice.
Yeah, excellent. Dr. Beatty, thank you for joining us on this Building with Purpose conference this year. Our theme is overcomers, and we're really framing these conversations to say we've had these unprecedented obstacles, but we can turn them into unprecedented opportunities. And your insight, your wisdom into how we can manage stress and get not just medically okay, but actually well and back to that healthy lifestyle is valuable. How can, if somebody has watched this and wants to follow up with you, how can they get in touch with you?
Well, I'm at 6001 Truxton Avenue, Building B, Suite 240, Bakersfield, California, 93309. And they can also call me at 661-395-0315. And I have a website, is HughBeattyMD.com.
Excellent. And I want to plug it for you. If you're interested in these 5 pillars, he also has a book coming out. And so be on the lookout. Be sure you follow him. He's on LinkedIn and Facebook. Go to his website. This book is coming out. If you want to know where to start, that would be a fantastic place. Dr. Beatty, thank you so much for joining us today.
Thank you very much, Justin. I appreciate it.